Well, hello, everybody out there in podcast land. This is April from Dental Ailments, and Cindy is on vacation this week, so I get the honor of interviewing a very special guest, Dr. Ron Schefdore. Hello, Dr. Ron.
How are you?
Good. I see you're in Florida, and it looks pretty nice behind you.
It's pretty nice, about 360 days a year here.
Well, it feels like Florida here for the past like 3 months. It's dry as a bone out here, but we need some rain for sure. But enough about the weather. I was trying to think of the history how we've met virtually. So you were on one of the Facebook sites, and I'm like, I got to talk to this guy.
Oh, thanks. I'm
Yeah,
glad you did.
yeah, and I was like, he's got some pearls of wisdom that I think will be very valuable, even though I'm just a little assistant.
Oh, assistant, you're the brains of the operation there.
Well, thank you so much. I was like, this guy's he's giving me some pretty good outspoken, which I like that type of advice. So
Hey, let me tell you just a little bit about assistants. 37 years of practicing, some of the best organization that I had in my office came from my dental assistants. Like putting everything in bins. 40 years ago, that was not really heard of. My dental assistant came up with that and says, look, we're putting all the composite in this bin, setting all the rooms up the same. It's like, what a genius. I mean, some of the really good systems we ended up with were definitely just from only the dental assistants, right?
right. Yeah, you should ask my husband. It drives him super nuts that I want to organize the house. I don't like junk drawers. Drives me crazy. So I need everything efficient even at my house. So yeah, it spills over, but they
Yeah,
work. Systems work.
it
So
does.
yeah. So you were in practice for how long?
37 years in practice in the Chicago suburbs, western suburbs.
Oh, you're in Chicago and retired to Florida.
Oh
Sounds.
yeah, now I'm retired. I mean, this is where you got to go when you retire.
Oh yeah, I grew up in Michigan in Midwest, obviously, and yeah, all the snowbirds went to Florida.
Yeah.
Yeah. So we have a lot to talk about today.
Yep.
And you have a special system. Would you call it a system that you use? Um, the no hygiene model. Is that what it's called?
Yeah, we have a couple of systems. One is with our periodontal program. They've been published in the front cover of Dentistry today, and people can go to the website and see it, the Pharmaden website. But the one that you're probably more interested in today, because hygienists are getting tougher to find, and a lot of doctors, over 250 now, in the last 18 months, have actually contacted me and said, "Can you teach me the no hygienist model?" So most of it I do for free. I really would like the doctors not to be scared about this, or the hygienists.
Hmm.
The hygienists are really, really valuable, but they're good for not every business model. So for me, when I was practicing, I like to do comprehensive dentistry. And so it required me to really talk to the patients a lot. And I could not stand, it was a deal breaker if somebody interrupted me. I did not want to be interrupted while I'm going through a treatment plan and the patient's crying or they're emotional. It's a lot of money. So I'm not going to do no hygiene checks, right? I'm not going to join in-network insurance companies to bring our volume up. I'm not going to get a bigger facility than I need to accommodate that. It just wasn't, I'm just not doing it.
Hmm.
So, we did our business model. I wish we would have we could have fit hygienists in with us. I just couldn't figure out how. And some of the hygienists that I interviewed, I mean, they just wanted to do bloody prophies and go home. And there are some great hygienists out there, and I've talked to them and I know them. But just like dentists, not all of them are really good. It just didn't work for me. So, but yes, we have a system and a model. It works very good. It's very profitable, low stress, better for the patient because I get to spend a lot more time with them.
Now, is there somewhere that doctors can contact you to talk about this or get?
Oh yeah, they can go to our Pharmaden site. Our Pharmaden It's the only nutraceutical or vitamin in the world that's been tested on periodontal patients, shown to reduce pocket depth, plaque, and bleeding. So it's a great adjunct to treatment because nutrition is part of the problem of perio in 3/4 of the patients when you ask them. So if you go to the Pharmaden site, it's PHARMADEN.net, and just look on the health professional uh, section, and then it says schedule a coaching section, and it's for free. I'm happy to talk to you guys about it as long as you want, or ladies.
Okay. Yeah. So I know you and I had talked about this at length in some of our uh, sessions, and yeah, it can, I wouldn't say be controversial. Would you say the no hygiene model? I want to say it's
Somehow it is to a lot of people, and oh my
yeah.
God, they really get excited about this. But once they understand that it's nothing bad with hygienists, it was just a model that was comfortable for me.
Hmm.
Hygienists didn't fit into that model, but I think hygienists are really, really valuable in other models, a higher flowing office in network. Um, it's great for a lot of doctors. I never had that energy to chair hop either.
Yeah.
I'm just too lazy. I just don't want to see more than, 5 to 10 patients a day. I don't know. I guess I'm not a I'm not a real high energy guy.
At least you found a system that worked for you, and then now you can kind of, I don't say customize it to other dentists, but it's a model that you can use universally.
Well, what's kind of cool is that, we figured out on probably 5 offices that I worked with how the hygienist actually does still fit into their office.
So on that note, talking about changes in the kind of the current model or old model, you'd say, of dentistry, the way they've been practicing for decades. You're an innovative guy, obviously. What do you think it's going to take to kind of shake up the industry and let people be innovative and creative?
Well, I've been writing about this and saying this for a while now, but tell me, who's ever listening to this, if you think this is too far fetched. So somebody goes to their cardiologist and has a heart issue, or they have had a stroke. And lo and behold, there's somebody, either at the doctor's office or somewhere, has noticed this particular person has periodontal disease. And it's a moderate disease, so it's been there for a while. Do you think, how far fetched is it that an attorney can smell money on this one? I mean, wherever there's money to be made, an attorney is going to do it. Well, if you look at the research, strokes and periodontal disease is probably the strongest connection. And then all the other 98 other things that can happen have been linked. How long is it going to take that attorneys smell another um, avenue to make some money and make a case for it? So I don't know. I just think that's the future. I just think human beings are human beings and lawyers are lawyers. And there's a lot of new patients that come into my office. I'd say the majority of them that have perio. And even the ADA says 50% of Americans have some sort of periodontal disease. When I go into an office and follow a doctor that has a hygienist high volume model, I find undiagnosed uh, periodontal disease all the time. So I don't know what to tell you. I just know what I know and what I see. And I think the future, I mean, it's not going to affect me one bit. But if I was a dentist today, I would be really, really strict. I would not allow bloody prophies, 5 millimeter pockets. I wouldn't allow 5 millimeter pockets and sixes. I just think it's that's the place, the foundation of oral health is we have to do perio. And perio needs to be taught differently in schools. When I had my periodontal program, there was nobody I couldn't get healthy. And you go, oh, well, I'll tell you why. And hygienists aren't doing this, neither are dentists. It isn't just a bacterial problem. And plus, it's products too. You let them go buy Listerine or whatever garbage is on sale at Walmart instead of having really good products that actually work inside your office for them to use. But they have to pay attention and ask the patient, are your nutritional habits really good, average, or poor? Periodontal patients will tell you average or poor almost every time. Again, there's a supplement, double-blind study for this to use as an adjunct to address that issue. And then when was your last physical exam at your physician? If it's been over a year, I require them to go and get a physical. The reason is because when I did the research in my office, and I had a CLIA license, CLIA, it's a license issued by the government that allowed me to take a blood test in my dental office. And we ran it, all kinds of blood tests. It was great. I really enjoyed it.
Mhm.
But what I found out was, what, 14% of my patients that went through our periodontal program, we diagnosed, not diagnosed them, we screened them for diabetes, and they had undiagnosed diabetes. We sent them right away to their physician for a diagnosis, and they confirmed it. There's been two other research studies 5 years after I had written my paper on this, confirming right about the same percentage that I did. So how do we expect good results on undiagnosed diabetics? Another 5% had some underlying medical issues. So that's nearly 1 out of 5. There's a medical issue. 3/4 will tell you that their nutrition's crap. We don't even pay attention to that. And then, forget the floss. 5 to 7% of patients floss. Get something that they'll actually do. Interdental brushes, toothpicks, water flossers. They'll do those many more times. Don't get people to do something they're not going to do. It's just the dumbest thing. So, I think we need to up our game on periodontal disease and be more robust, have a more robust program. I've been writing and saying and doing this now for 20 years, that particular program. And I've invited universities to please, use my program, see if you get the same results. I mean, there's nobody we can't get well. So,
I know you and I had also talked about where we could do a couple episodes because you and I share a story about siblings who are diabetic. And I'm going to do that in another episode. But you bring up nutrition, which it's a great piggyback to the interview I just had last Friday. I don't know if you've heard of Dr. Uchi out of Toronto, but he's now. Have you talked to him before? Yeah,
some years ago, he's been around a while.
yeah, and it was fascinating talking to him about the lack of nutritional counseling in the office in the practices.
Oh, it's
It,
not non-existent.
yeah, and it's just like incredible what we could be doing on the front lines, as you were talking about in the comprehensive exams. Like, hey, are you eating like crap? Or do you have any health issues? And, yeah, go see your primary care physician. And this, your mouth's connected to the rest of your body. People forget that.
Yeah, the thing I had with nutrition is trying to change people's eating habits.
Hmm.
It's pushing a boulder up a hill. I couldn't do it. So after about 5 years, I had to look for other avenues. And vitamins off the shelf weren't working, so we had to develop our own nutraceutical, and we did, and it helped. It worked. It filled that void.
So I think that, and you're talking about that blood work. It'd be incredible to do that in the dental office. It would help so many people, and that'd be the good groundwork to help with their. We know they're going to get perio, or they already
Well,
have it.
the exciting thing for me is, we tested homocysteine and high sensitivity C-reactive protein, and there were so many people that it was so elevated, those inflammatory markers, they were just setting themselves up for a stroke or some other disease. And so, I said, even if your gums, if you don't care about your gums, you're setting yourself up. Here's the data on this. A high CRP with a high homocysteine and poor eating habits. I mean, you're going to get a stroke or a heart attack. And they go, oh, well, you got to die of something. Yeah, but I'd rather die at 80 than at 50. You know?
So that brings us back to talking about a potential lawsuit that may be happening in the future that will shake up dentistry. And I think you're absolutely correct on that. That's what it's going to take.
That's what it's going to take. It's unfortunate that we're not going to do it on our own.
And then that you also brought up dental schools. How do you feel dental schools should change their curriculum for these future generations of dentists here to help them also be more innovative and
I find they just don't want to. They're not interested. They want to just the doctors I've talked to at dental schools that are there to stay just don't want to work real hard and shake things up. I'm sorry. I'm going to call it the way I see it. And you guys dug your own grave. I've talked to probably 100 of you guys, and it's just like you just don't care much. And we've got to change the educational system, especially if they're paying five or $600,000 for the education, and the requirements have gone down. Don't get me started on that. That's a whole nother program. But we're not getting people well. It's more of a let's make money game, and money's great. I mean, we always did a million. Our overhead was less than 50%. I mean, you'll make money in dentistry no matter what you do, but why not get people well and do better quality?
So do you feel like sounds like a more holistic approach to dentistry, not just taking mercury out of teeth and placing with composites, but whole body health?
Well, it has to be because it's connected,
Right.
right?
Right. And people forget that this big gaping maw that we have in our head is attached to the rest of the body.
Dr. Mayo said years and years ago, dentistry is just a branch of medicine. That's we are. I was hoping that dentistry would work closer with physicians. It would help the whole profession, both professions, to go back and forth and work with each other. We're a branch of medicine. If there's an infection in the mouth, it's going to affect the body. People are getting artificial joints put in, and they have perio. There was a few doctors that were smart enough to send them to me before they did the surgery to get a dental clearance. And I got to tell you, three-quarters of the patients that they sent to me to get artificial joints had perio. I had to treat. I documented everything, showed pictures. Patients were all mad, and surgeries are undocumented. But those artificial joints will fail. A percentage of them will if they're going into surgery with periodontal disease. But that's not a big thing, except to a very small handful of physicians right now. I think that's a shame.
Yeah, and honestly, when I talk to physicians about dentistry, they give me kind of a blank look. They're like, "We maybe learned the teeth numbers. That's the extent of it." I even had a physician once ask me during a root canal if we extract the tooth. I thought he was joking, but he wasn't. I'm like, wow, that's they are pretty inept when it comes to the oral cavity.
It is. I had one physician once. Uh, we were getting ready, and he asked what the fee was, and I told him, and he goes, "Oh, that's not worth it at all." That's there you go. Here's the pliers. Do it yourself. He tried. He actually tried.
Really?
Yeah. I says, "I'll just sit back here and wait until you're done." About 10 minutes of that, he gave in.
Wow. Yeah. So, do you see? I know they talk about physicians and dentists finally teaming up. Do you see that happening?
Well, AOSH, Chris Kammer started that, but it was based on a seminar that him and I did together years ago, talking about this very subject. And talking about, we actually had an attorney on the line that at that time was suing dentists, and he passed on just not much later. So it didn't carry on, and it didn't catch on to the rest of the field. But we talked about this 20, 25 years ago, and it's still not happening. So I just hope the next generation of dentists are more health conscious. The country that's going to lead the world and be the strongest is going to be the healthiest. And if we can pay attention to health, then you have more productive people. Um, you could outpace, outthink, outwork any other country. And I think the future of America depends on health and keeping us healthy, healthier than the rest of the world. We're not right now.
We're not mentally, emotionally, or physically.
No.
Um, what do you think it would take to get the medical and dental industries to finally melt together, connect?
Well, there have to be intervention, lawyers, like we had already talked about, government intervention. The government can say anything, and they got to do it. I mean, look what happened with COVID, right? Whatever they said that we had to do, regardless of what you thought. So I think, getting the government to actually understand and to think what's best for the country, and start making stricter rules, making the education more robust with perio, making the requirements a little tougher than they are now in
Mhm.
dental school. So
Sounds like we should have you lobby in DC.
should. I wish some people would listen to me. There's always these hidden agendas, though, too, that we don't know about as
Right,
citizens, right? Because sometimes things just make sense. It's like, why isn't this not happening? Well, it's because we don't know the other back half of the story.
right.
So,
There's
and
some
we never will.
right,
Yeah.
right. So what do you think it would take to empower hygienists, dentists, and assistants? Because you really value. I can tell you really value everybody on your team. You're
Oh, absolutely. I don't know how this would work, but is there a specialist? Should hygienists own their own office and be specialists in one area, right? With hygiene perio. The problem is how would I take my patient and refer them to them and hope they come back to me like they would with I I don't know how you'd work that out, but I could definitely see that dentists aren't interested in talking about perio, getting people well, periodontal wise, which I don't understand. It thrills me to do it. I got paid well doing it. But most dentists don't have that interest. So give it to the hygienists. They're interested. They've gone to school. They're very well trained. But once they have, I just don't know how that's going to work with my restorative patient that I need to get back after I send them there first. Um, I don't know. That's for bigger minds to figure out.
and you were talking about the assistants feeling more empowered and using their skills to their fullest extent with the hygiene program you're talking about, where we do everything to the top of our license, of course, state dependent, and then we bring in production that way as well.
I've had such good dental assistants. I mean, in Illinois, coronal scaling is allowed. The polishing, the fluoride treatment, the X-rays. They talk to them about all the products that I want them to use, showing them how to use all the products. Oh my goodness, assistants are so valuable. And really, I've had some really good ones and really caring ones, and they're about half the price of a hygienist. So, I mean, $25 an hour versus 50 or more. And plus, well, I don't know about today. They will in a few more months when the government quits giving money out. But I think assistants are easier to find, easier to train. Um, I think it'd be silly not to cross. I had 3 cross-trained people in my office, and I loved it. It was great.
Yeah, and I'm hoping. Well, I think all the assistants in the are hoping that one day there'll be like a national licensure
Yeah.
as a requirement. I mean, I've worked with some amazing assistants that have been on the job trained. But it boils down to personality and patient care and your bedside manner. Technical skills you can teach to anybody, but having that certification or licensure across the board will make it so much easier
Yep.
for
And
us.
what's really interesting, some patients, a good part of them, actually trusted my dental assistant, I think, more than me. I Doctors, if you think that you're God in your office, you get another thing coming. They'll trust your hygienist, your assistant, sometimes your front desk. They'll say things to them that they'll never say to us. So, you know, I think really good people with a warm heart you're right. Those are the people I hire. I stole them from other businesses too, from Starbucks to Dunkin' Donuts to, a waitress. I mean, if they're really good, they're smart, they care for me, and they know how to service me. Oh man, I'll jump in there. I go, how would you like to make a lot more money than what you're making here?
Yeah, it's
They
true.
go,
I've heard that story many times, like poaching from other industries because you see the value in how they treat in customer service. Patient care is customer service to an extent.
it is.
Hmm.
Caring people with a warm heart, boy, there's nothing better than that. But if you're
Right.
a fast-paced office and your business model is just strictly, money and get them in and get them out, I mean, I can't blame doctors for doing that. My first 17 years, we had 3 locations, 6 associates, and a staff of 30. I get that, and no dentist is to bullshit me about anything about dentistry because I've had all the models. And for me, I mean, making money is great, but once you have it, to me, it felt pretty empty because I really wasn't doing what I really enjoyed doing, and that's helping people get better, working with my hands and my brains, and just helping people get healthier. That's so much more fun. Building relationships with patients and doing some meaningful dentistry. That's the fun of being a dentist. That's why I survived 37 years. After 17 years of making a lot more money than I did the last 20 years, it was just an empty feeling. It wasn't a lot of fun doing dentistry. So what? So you made a lot of money, but you didn't do really what feeds your soul.
Right.
And
So,
I,
right.
I would I would encourage all staff members um, and doctors to do what makes you really happy, what gives you the fertilizer for your soul.
That's a good way of putting it. Yeah, what's going to fulfill you? And
Yeah,
I think at heart we're all caregivers, um, and we want the best for our patients. I know everybody says that, but it's true. And finding that, planting those seeds and watering those seeds that will bring everybody happiness, especially yourself. Um, these are really amazing ideas. I know we've had this discussion many times. And where can dentists? You have this your coaching program. It's called DRS.
DRS Coaching Systems. It's a Facebook page. You could just look it up and see what other doctors are saying about it. I got into it. I'm retired. I'm not going to spend the money that I've got. So I'm not doing this as a business and seeing how big I can get and blah blah blah. I mean, some dentists think that's why I started this. When you have 250 doctors get a hold of you, you got to think of a name of something and funnel it in there, right? And give them some information. And so that's how I got into coaching. It wasn't something I wanted to do. So what I did is I only work if dentists want to work with me more than just one or two consultations. I'll work with them for a few months, and I only work with 4 practices at a time. I'm I'm retired,
Right.
so I only want to
Isn't
do
that
this like
cool?
right 15 to 17 hours a week is all I really want to do this. So I work with 4 offices and then rotate them. I try to get them out of the counseling. Charge them a few $1,000s a month. I charge them to pay an assistant to help make them millions of dollars. Okay, that's how ridiculous the ROI is on it for them. But I work with them, and I really within 8 weeks they should have enough information, like how to read reports. Doctors say, "What do you mean reports?" There's 8 reports that you should read that should be generated at the beginning of each month. And my CFO did that. Your bookkeeper could do it. There's 8 reports. And if you read those 8 reports, you can manage your practice no matter what size it is. And in 15 minutes, you'll know what's going good, what's going bad, what needs to be changed. It's so valuable to have reports. And no doctor, not one doctor I've talked to yet has generated those reports. So I teach, that's one of the things I teach them how to do, how to be a leader. Nobody's ever taught us how to be a leader. They just think they're a boss and they got to bark out orders because they're paying everybody. That's not being a leader at all. Leadership training, staff meetings. Most of them, their staff meetings, a lot of them have quit them because they're just bitch sessions. And the purpose of a staff meeting is to solve a problem and be productive during that time. So there's a specific way to run a staff meeting. And so we go through that, just the basics that really should have been taught. Systems, you know about that too, right? You got to put
Oh
some
yeah.
system
Oh yeah. You got to keep things organized. It's much more efficient. You save time.
and stress. If you got to leave the room to go find an instrument, that's crazy.
It is, and I can't. I bet if you added up all the minutes of us running down the hallway to the next operatory, and the
Yeah,
patient waiting there, and then the docs, you're empty-handed, and it's like, oh shit.
put all the tools, everything at the same place in every operatory. It's just so much easier to do. Just like the train. They go, oh, well, how do I train somebody if I take them, from Starbucks? Well, I had some, on the iPad at work. We had the videos of all the tray setups, how to sterilize. I mean, it was basically like a YouTube forum, right? They didn't even know what a sterilizer was. Well, we talked them through it in a 5-minute video. They knew how to sterilize instruments. They knew how to set up my 12 trays that I wanted exactly. They didn't even know the name of the instruments. They didn't have to. My dental assistant would learn that. But it's like, okay, day one, here, this tray, go set it up. Go watch the YouTube, set it up, bring it in the room. How to clean a room up. We videoed how to clean a room. Those videos are really, really valuable. So you go through it on person, and then they could go to the video and go fast forward, go back. You could train a dental assistant can be trained fairly quick. But doctors, oh yeah, I never thought about that. So
I know it's simple stuff that like you and I think about, and then I go into these offices and they ask for my advice, and I'm like, well, you kind of have an area. I mean, it looks like a bunch of junk drawers, and it takes a lot of time for us to sift through these instruments and put them in order. And I tell people, I tell dentists, you're like the chef. In any office I go into, you're all chefs, but you all cook a little bit differently.
yeah,
So I want to know how you cook, so I can get we can the patient the meals exactly how you want it.
yep, yeah. There's a doctor that is just finishing up with 50 videos, and they're about 7-minute videos on how to do for doctors on how to do techniques to save them time. And it's amazing. I'm going to be if you guys want to know more about it, it's going to be released probably in a month or two. But boy, every doctor ought to get something like that just to help them on the doctor side to know how to cook better, right? A lot of doctors are cooking, but it's so inefficient the way they're cooking, right?
Right.
You know,
You're gonna have a
they're
burned
still,
meal.
they're still taking an hour for a couple of fillings, and it's like, oh my goodness sakes, and still open contacts. It's like, here's a 7-minute video just to show you exactly how to do this. And it'd be really, really good for that first 5 years in practice because you fumble through things and you didn't learn much in dental school. So that's coming. If anybody's interested, just let me know. I'll let you know more about that.
Yeah, please do. I'd be curious to see those. And I have younger doctors. A lot of them are younger than me now. Asking for advice like that, I'm like, hey, no problem. I'm happy to do it. You
Yeah.
need some good tips. And they're like, I never thought of that. Or they're like, you think of things logically from a different perspective. I'm like, who would have thunk?
Now, do you go into offices too and show them how they could actually save money by being more efficient?
I do show them systems. I don't have the actual analytics, but just the time alone that they see, it's funny how the light bulb goes off. They're like, I never thought of that. I'm like, yeah, just years of practice. It's just little tidbits and pieces of advice that I've gotten that's really helped me out and save time. And it's
Yeah, I just told the doctor's office about they were buying their supplies from four different vendors. So when I talked to the office staff, she spent like an hour ordering supplies every week. I go, look, there's one vendor that's cheaper than everybody else. Go ahead and check it out. Just stick to one vendor. Now, every few months, you can compare and make sure they're honest about it. But I go, if you could find one vendor that's really good, so she's using it now and it takes her 15 minutes instead of an hour. I mean, just that one little thing that's 45 minutes a week on one staff member, that's 18 bucks a week. I think she was making 25 an hour. So that's about $18 a week,
Mhm.
plus the time that she could spend doing something else. It's more productive.
Interesting you bring that up too. I'm talking to a doctor out here that he just developed a new dental software. And there's a bazillion of them out there.
Yeah.
Dentrix, EagleSoft.
Yeah.
But when you look at those softwares, it's just a lot of extraneous stuff, a lot of words, a lot of buttons, which takes up a lot of time. So he came up with this new software. It's almost, I joked with him, I said, it's almost too simple. And he started laughing. He goes, yeah, he goes, it would drive me nuts when I'm in procedure and I look at these softwares and I'm looking at all this stuff we don't need. I said, yeah, it's like the junk drawer. And it's incredibly simple. And I'm going to be looking into it and training on it just out of my own curiosity. But I'm like,
That's perfect. Dentrix should have came up with like a basic dumbass model, right? I would have bought that in a minute.
Yeah, dental
But
software for dummies.
yeah,
Yeah.
just let me make an appointment. 6 things. Here's the 6 things I want to do and do them really well. Not 55 things that we might use someday, maybe. And if I do use it, I'm not going to remember how to do it anyway.
Yeah. So he's gotten ahead of the game with them. I'm like, this is really too simple. I'm like looking for things I don't need. And he's laughing at me. He goes, yeah, because we don't need it. I said, yeah, you're right. And he took actually someone from another industry, never been in dentistry, and it took them only 2 weeks to learn the software.
Well, do me a favor when you get the information, just send that to me too. I'll call him. I'd like to talk to him.
Yeah, he's a really cool guy. Trust him quite a bit. So yeah, I'll do that for sure. And you can if you think it's a good thing, you can tell their dentist about it.
Oh, absolutely.
Yeah, yeah, yeah. So well, it's been amazing talking to you as always. And to the
Thank you.
assistants out there who are listening, please get a hold of Dr. Ron. He's been nothing but respectful to me, answers my questions, keeps it real, which I like. He doesn't sugarcoat anything.
I do not.
And that's the way it should be. And always open for advice. Well, maybe I shouldn't volunteer you.
Hear me.
Yeah, yeah.
Assistants, you guys need help too. And you should be, the thing is, you should have a talk with your boss at the beginning. If you're good and you know what you're doing, you should be respected in the office. And don't, just because there's a DR in front of his name or pays your bill or writes your check, that no, you got to be respected for what you're doing for the office, what you're doing for the patients, and you're a valued team member, just like a hygienist, just like the front desk. And the doctors, there's so many of them that are just so ignorant. I have to talk to them. I just got to tell them, you're an awful leader. You're just awful. I just had to tell a doctor that today. He was just a jerk. I go, why are you such a jerk? I mean, who's going to want to work with you? No wonder nobody wants to work with you. And it's, they get this degree and they're called doctor all day. And, they write the checks and they just think they can say and do anything. It's like, didn't your mother teach you anything?
Right. Right. But see, he keeps it real, everybody. Leave it to Dr. Schefdore.
Oh, I'll tell them. I mean,
Oh, yeah.
you
Yeah. And hopefully they listen.
many won't,
No,
but
well,
okay, we'll get some of them. But be respected. Don't let doctors, not respect you guys.
well, it's been a pleasure. And again, to find you, it's DRS Coaching.
Systems, DRS Coaching Systems. That's a
Okay.
Facebook group. And
Okay.
then if you want to make an appointment with me on my calendar, it's at pharmaden.net, PHARMADEN.net. And you look under like professionals and you can find my calendar in there.
Excellent. Well, please take my advice. If it's worth anything, please get a hold of him. He's a wealth of information and has mentored me and always up for questions. And I'm always up for his answers and his entertainment. So thank you, Dr. Schefdore. It's been great.
Thank you for the interview.
Absolutely. Have a fabulous weekend.
You too.
All right. Bye-bye.
Bye.